very, very sad. I mean, every single loss from COVID is a loss that we didn't want to have, regardless of age and regardless of the other health conditions. On this occasion, the person involved did have other health conditions. And we must remember that this is a highly successful vaccine, but if only 10% aren't protected, then 10% is still quite a number of people when we consider the number of people we vaccinated. So the vaccines work. There are those, particularly with these conditions, where the immune response isn't the one that we would like. But it's very, very sad, absolutely.
We have been having a high number of vaccinated people who are testing positive within the parameters that's to be expected. Hospital admissions have been quite low. So if people don't go to hospital, we don't tend to hear much about their condition. What can you tell us about the condition of those vaccinated people who've been testing positive for COVID in the last few weeks?
Well, the fact that they haven't had to be hospitalized means that their condition isn't as serious as when we had previous waves, when the hospital had many more patients there. And some people have it with stronger symptoms than others, but on the whole, the symptoms have been much milder than in previous waves. So again, that is proof of the success of the vaccine.
And the government banking on that vaccine. We had the new consignment arrive on Friday, enough to vaccinate, I think, up to 600 individuals. There was already a waiting list, but add to that, new cross-frontier workers are going to be prioritised. And importantly, young people who are at risk, 12 to 15-year-olds. What can you tell us about that? And when is that programme starting?
Yes, there's about a waiting list of around 200. And also we are inviting young people who've recently turned 16 to also come forward. And only today we were planning on starting the vaccination of vulnerable 12 to 15-year-olds. This follows a case in the UK, which is where this is being done. I'm personally hoping that we will get the all clear to vaccinate all 12 to 15-year-olds, but that's up to the experts and not up to me. So hopefully there will be more vaccines coming in the future that will allow us to cover those as well.
We've seen the UK as well having to reassess its self-isolation protocol. What can you tell us about self-isolation protocol in the next few weeks? Are you looking at reviewing that?
Well, at the moment, it seems that our current strategy is working. Today, I think we're around 116 resident positive cases. The peak was 340 or something like that on the 31st of July. So clearly the trend is going down. So I think our strategy is working. And if it ain't broke, don't fix it. So at the moment, I think we're holding steady and hoping that the cases will continue to decrease and perhaps decrease to where we were some months ago, which was almost normality.
And we did end last week with good news. ERS was opening up to the general public. Those visits were being allowed again. But one contradiction, that same day, the hospital announced in relation to its escalation plan that surgical lists were being reviewed on a daily basis, which provoked some criticism from some sectors in the community. What can you tell us about that?
Well, this is a matter for the GHA. And they obviously have to assess the relative risk between having an open hospital and not continuing with surgery that people may need for other reasons. It's a matter for the professionals, and I think they, as usual, they're handling it well. They've just been given the freedom of the city, so clearly the community feels they're handling it well.